My impressions so far are, on the one hand, I believe that the program is working on a number of pertinent, very important health sector issues in Kenya. In particular, I'm very impressed by the work that is going on with regard to the health insurance issue, where the program is actively working on providing support to the Kenyan government in terms of not only reforming the social insurance system or health financing system, but also increasing the access of the poor to those systems. I think that is one of the key challenges for countries like Kenya, and I think that is a well-picked issue for the program. And then on the other hand, the program is also very active on working on strengthening financing in terms of cost efficiency and providing finance for hospitals and other institutions. And then I think a very, very important issue is to work on improving the health situation for mothers, for females, for young females, improving their healthy situations. I think that is clearly a very good agenda that the program has picked for its work, and it should, in my view, be focusing on these issues also in the next coming years. Perhaps one area where I believe we can intensify the work within the program is to improve the preparedness for the Kenyan institution and government for disasters. I have learned that over the most recent drought episode here, the program has been very fast, very quickly and adequately helped the Kenyan government in terms of providing assistance, quick assistance to drought victims, to many, many refugees, especially in the north. And in doing so, I believe the program has worked intensively with faith-based NGOs here in the country, both from the Christian side and from the Muslim side. I think that is an excellent example of stepping in when something urgent has to be done. And so that is certainly something where I believe the program can continue or perhaps intensify supporting the Kenyan government in terms of getting ready in case one would not hope for, but these natural calamities do happen, and I think it's worthwhile to help supporting the government in getting ready to be prepared if a calamity happens. So that's certainly one area. The other, I believe, perhaps we have a scope in intensifying the work of drawing upon the expertise of alumni of training courses that have been provided in the past. We had a very, very interesting meeting with a small number of alumni who are working in the health sector in Kenya, and I believe this is a fantastic network of people who are well placed in the different segments of the health sector in Kenya, and they're very knowledgeable, they're influential, and I think that's certainly an area where we can intensify providing assistance to those alumni trying to improve their networks. Working in a drought situation or in a calamity situation very quickly with NGOs, trying to provide help in the health sector to refugees and calamity victims. That's certainly a very good practice. Another good practice, I believe, is the work that the program is doing here on the reform of the health insurance system. There I know there are also other countries very actively looking for possibilities to reform and getting more poor people into the social safety net that governments and others can provide. And I think here the program is on a very good path in trying to provide help to the government, and so it should continue doing so. It's a very good practice in my view. I also think a very good practice of the program here is that it is applying a multi-level approach. We are, as is customary in many programs of the German Development Corporation, we are active not only at the national level providing advice to the government, to the national government, but we are also active at the more local level, for example at districts or counties, providing assistance to some chosen districts or counties. And we are also providing direct assistance through our development workers at specific institutions. And one, for example, I visited this morning, the Biafra clinic here in Nairobi, which is doing an excellent work in general in providing health services to a Muslim-dominated community in a slum-type area in Nairobi. And we have one of our development workers supporting this clinic in a very good way. So I believe that's an excellent feature of this program here in the health sector in Kenya, that we are working at the different levels, national, district, but also even more at the basic level, providing assistance to some specific institutions like the Biafra clinic. Perhaps there is potential in exploring more the intersectoral cooperation, not only working in the health sector, but also looking at how can we combine our assistance that we are providing in, let's say, the water sector or the agriculture sector, and using also our activities from the health sector in, linking up with activities in those sectors. Also in the education sector, perhaps providing more health advisory services to schools, to the education system, to spread the message of healthy lifestyles in schools, among the teachers and among the parents. So looking at these intersectoral links is perhaps another area where we, in general, as a German Development Corporation here in Kenya, could intensify our efforts.